everyone, this is Dr. Mike Show, physical therapist. Hey, today we've got a special guest. Well, actually, I'm the guest here, but before we keep on going, check out hellonote.com. We use that for our documentation system, and of course, use Alternative if you need CEU for your MedBridge education. Use the Alternative code. Okay, again, we are here at the Slayton Corner Clinic with Dr. Ruth Slayton. So I've been reaching out to her. And it's been like, how many years, Miss Dr. Ruth?
It's been about 2 since you've been here.
Gosh, yeah, it's been a while.
4 since we got started.
I know, right? So, well, anyway, before we keep on going to the current, let's go back to the past. Miss Ruth and I used to work together at the hospital. She's been amazing. She was an RN there, and then all of a sudden I saw her fighting. And what do you call that? Taekwondo, karate, and everything like that. And then, of course, when I learned that she knows how to do self-defense, I stopped bothering her at the hospital. Then she quit. And all of a sudden, where did Ruth go? She's an amazing nurse. She took care of our patient at the hospital. And out of nowhere, I saw her, became a nurse practitioner, and now she got this amazing clinic here, Slayton Corner Clinic here in Milan, Tennessee. And she's been running this private practice clinic for like 3-4 years now, and then she's grown. She's got all this new equipment, these new amazing ladies. But before I keep on going, I would like to Dr. Ruth to introduce herself again. Tell us again who you are, what you do, and then after that, introduce this amazing, beautiful ladies here.
Absolutely. So I'm Ruth Ann Slayton. I'm a doctor of nurse practitioning, and I have the clinic here in Milan, Tennessee. We do primary care, a lot of weight loss, and injury, illness, all of the regular stuff.
Or you're looking at me when you say weight loss, right?
We can help with those things here. Mm-hmm. Also, my staff is with me today, and they are a little camera shy, I believe. But
all right, Megan and Melissa?
Monica.
Megan and Monica. Oh gosh, I gotta remember that. Okay, so Megan, where are you from?
I'm from McKenzie, Tennessee.
McKenzie, Tennessee. Okay, that's where we go to church. Shout out to Overflow. How about you?
I'm from Milan.
From Milan. Okay, so what brought you here today?
Work.
It's like, oh, whatever. I'm just gonna be here. The boss told us to take a video with us. So, tell us. So, what do you do with Miss Dr. Ruth? So.
I do pretty much everything. I'm a medical assistant.
She also does PAs for me. She's
prior authorization.
Yes,
oh gosh.
She does PAs for me. She schedules appointments. She assists with procedures if need be. Pretty much her and Megan interchange with a lot of things. Megan does the primary triaging of patients. And
we need that. Very important people. You're the first line of defense when it comes to our patient, right? So
since they've been on board, I have to draw less blood now.
Woohoo! That's the same thing with us too in our clinic. We got all this, our front desk, or we got a separate person who does all the prior authorization. She's like remote and does it the whole day. Shout out to all the people who does help us out in our private practice. But
weight loss, you have skin laxivity, and you also have the remaining like fat cell issues and stuff when you lose weight. Everybody wants to be tight and toned, but not everybody wants to go through surgical procedures to do that. So these machines work without surgery, without invasive procedures, and basically work through bipolar radio frequency, heat, and E-stim to actually kill the fat cell. So I'm Ruth Ann Slayton at the Corner Clinic in Milan, Tennessee, 1104 West Van Hook. We have new machines here. We have body sculpting machine, Evolve X, that actually destroys fat. It works through heat, bipolar radio frequency, and with E-stimulation to basically kill the fat cell. Works on tightening and toning, and that's for the abdomen, back, arms, and legs. And so this is great help for any weight patient or someone just wanting to tone and tighten. The abdominal part of this through your treatments is like doing 1,000 sit-ups during your treatment session. So that's a lot of exercise. You actually will feel like you have worked out several days after. No pain during the treatment. It's not an uncomfortable treatment. It's non-invasive. There's no needles involved. A lot of people want to know that. And then we also have Define. Define is a jaw and chin tightening machine, and it works the same way, but you have an apparatus on your head that then tightens the jaw and helps with excess fat in the jaw and chin area. So these machines are few and far between. You can find some of these in probably Memphis and Nashville areas. We are the closest one here in West Tennessee. I do know that our prices for these machines are very competitive as well, because we have a market here that's a little different than the bigger cities. And we are working these into like a 3-month membership where you have 12 treatments during your 3 months. It takes about 6 to 8 treatments for most people to get to where they want to be with one body part, so they would actually have opportunity to move on to the next one during that treatment phase. Also, as an add-on, the Define is an add-on to the Evolve for the face and chin, and that is just like an upcharge to the membership. And you can do it alone as well. There's some people who may want to do that alone. So InMode is the name of the company that developed these. They are a very, I've researched them well, a very good company. These are great machines. They do what they say they're gonna do. We've seen a lot of the...
so is it like an ultrasonic sound waves plus
okay, they're put on as belts, and then with belts and with sensors.
Mm-hmm.
So you use the sensors on the body, and they actually have the bipolar, they heat up. They have the E-stim, just like E-stim, you know, with physical therapy, you have E-stim as well. Does the same thing, works through that, and but absolutely have, I mean, you just sit there for 30 minutes to an hour and have your treatment, and then you can see the difference very soon.
So the session normally lasts for 30-40 minutes. How long is the usual plan of care?
Okay, so what we do is we do 12 weeks, a treatment a week for 12 weeks. And then from there, you can go further than that, but that is how the initial sign up for treatment will be 12-week treatment.
Is this, I assume this is not covered by insurance, so is it out of pocket? Mm-hmm.
It is an out-of-pocket procedure. Mm-hmm. Cash pay, we do it as a membership where you pay so much per month for 3 months.
Wow, amazing. And then aside from weight loss, you know, the actual physical, not really physical manipulation, but you know, this machine here, do you have those other weight loss regimen that you have?
Absolutely. We do a lot of different weight loss plans, but we are a weight loss program where when you order medication online and you tell a doc medication for weight loss, you don't get a one-on-one service that helps you with your eating habits, with making sure you're getting your protein intake, which is so important. We work with the patient to make sure that they're making those changes that are necessary, and proper dosing of the medicine is very important too when we're talking about the GLP medicines, because the GLP medicines have side effects. Higher doses, more side effects. Not eating, more side effects. Not getting your protein, less muscle. So all of those things come into play when you're talking about weight loss, especially in as we get older, we lose weight. If you don't get enough protein, you see those people who are not getting enough protein because of the loss of muscle.
Yeah, they get, you know, atrophy and everything. So she's correct. You know, when you take those GLP medication, whether it's whatever brand or generic, you know, and if you are not properly loading your muscles by exercise or properly giving nutrition to your body by proper protein intake, you're going to lose. You're going to create atrophy on your muscles. So you'll see those patients. Oh, they did lost some weight, but you'll see that they don't have any tone. They don't have any muscle power. You know, they have atrophy on their muscles. So it's very important that you go to an actual good practitioner who will teach you and guide you and mentor you. Okay, this is how you properly lose weight. And then if you have those loose fats and everything, then you can do this actual machine to really target those muscle belly or muscle fats that you really want to lose. So that's so good. Ms. Ruth, what other services else that you provide aside from the weight loss and everything? You do regular primary care?
Primary care, family care. We take care of people from 6 months up. all the way to 110.
110. Is that your oldest patient right now? You got 110?
No, I have actually right now my oldest patient is 93.
Wow. I have an 100-year-old.
Wow.
Somewhere there.
That's awesome.
I know, right? It's just amazing. We've been
But
seeing
what
her.
can you tell a 100-year-old? Because really, there's a reason they got to be that age.
Yeah, no,
right? They're
but-
doing something right.
That lady over there, we've been seeing her forever. The family is just so nice and very thankful. They'll always tell me, Dr. Mike, without you, because we see her under a maintenance program for physical therapy, without your services, she would have been in the. We see her in the home. They
That's
used to
great.
drive her all the way from Martin to Jackson. Now, of course, we see her in the home, but the services that we provide, whether you're on physical therapy or you had a private practice like Ms. Ruth there, you're changing people's lives. Even you ladies, you have an amazing purpose here. Imagine you're working for someone else, you're doing your job, and you're changing people's lives. That's the ultimate job or a vocation that you can do. You're making money out of it, and at the same time, you're helping people get better and stronger and lose weight and do what needs to be done. Ms. Ruth?
And that's what I try to incorporate too here at the clinic is spending time with my patients because that doesn't happen much anymore.
Yeah.
Corporate healthcare, we're told you need to see 6 patients an hour.
Well, yeah.
And I'm not a 6 patient an hour healthcare provider, and I sit down with my patients, we talk about it, we try to figure things out, we try to figure out why, and they make sure that I don't take too long generally, but with the patients. But anyway, but absolutely.
Our data people is like, hey, your next patient is here. They've been waiting for 30 minutes, right?
Right.
So, yep. So that's the same thing with us too. We schedule our patients for a full hour, and then if I'm there for an hour and a half, our techs and our nurse, our PTAs will holler at me and then kind of open that door. They're not going to tell me, hey, you're overtime or your next patient is next. They just kind of look and then say, give me a little cue, hey, you're overtime there. So, but thank you for everything that you do, ladies. So you see from 6 to 93 years old.
6 months.
6 months.
See the babies too.
Working, I know, right? Do you also go to homes and assisted living and everything like that?
We did go. We did do that. We don't do that. We don't do that as much anymore. The assisted living that we went to is no longer open over here in Milan.
Oh, okay, yeah, Wesley. Yeah.
We don't do that.
Well, anyway, where can they find you? Do you have obviously your telephone number, your address here, and everything? Let's go ahead and let this lady talk now. So yeah.
Our telephone number is 731-238-2338.
There you go. The address here. Where can we find you guys?
1104 West Van Hook, Milan, Tennessee.
There you go. Again, thank you very much. Any last parting wisdom that we can share, Ms. Ruth, for our audience?
No, we appreciate you coming today, Mike, and we are excited for these new machines. We've been certified to use them on our patients, and we're excited about making a difference.
There you go. Oh, you mentioned that this is not the machines that they have here are very fancy, and you can only find this in the bigger cities like Nashville and Memphis. And I think this is the only, I would say only, right, facility that you can find this here in Northwest Tennessee, I would say, right? So check them out. Anything else, Ms. Ruth, or are you good to go?
I don't believe so. If you
All right.
have any questions about our services, please call the 731-238-2338 and speak to Monica or Megan, and they'll be glad to help you.
All right, but before I let you go, always remember the word FAST, F-A-S-T, letter F. Find people that will bring out the best in you, because you are the average of the 5 people you hang out with. So whoever you hang out with, that's going to be you. Hang out with people who are amazing. Guess what? You're going to be amazing, just like Dr. Ruth. So next letter is letter A, take action. All this stuff that we're doing, it's not going to do me good. It's not even going to do Dr. Ruth good and Monica and Megan. I will go forget Megan. It's not going to do us good if you don't take action. Take action. Go call their telephone number. Go check out their website, SlaytonCorner.com. Is that correct?
Slayton's Corner Clinic.
SlaytonCornerClinic.com. Take action. Go just call them. Hey, what are the services that you provide? Hey, how can I lose weight? Hey, it's very important that you take action. Okay. Next letter is letter S. Share, subscribe. The more shares, the better. Share their website. share their Facebook page. You have a Facebook page?
Yes, we do. Yes,
Share their information. It may not be applicable to you, but it could be applicable to someone else. And last but not least is let our teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like Dr. Ruth is doing, she's teaching us how to lose weight, how to be better, how to be stronger, how to not develop atrophy, how to eat well with protein, the more you understand it. Again, thank you very much. Be awesome, be great, be excellent. We'll see you in the next episode of our Jerry Half Show.